A symbolic walk for peace in Maiduguri, a city that has endured the impacts of conflict for more than a decade. This year's World Peace Day comes at a critical time as Nigeria continues to grapple with pockets of insecurity across the country. The theme, Act Now for a Peaceful World, resonates strongly with citizens yearning for stability and safety.
There is no country that exists without peace. Once there is no peace and you choose violence, at the end of the day, there won't be meaningful development in society. And so, as an officer, we always advise and campaign that every part of situation you belong to, you must choose that of peace.
From Moduganari bypass through the Federal Secretariat and down to the NSCDC headquarters, personnel took the streets with a singular message. Peace is possible, but only if everyone plays their part.
We are urging the people of Borno State and the environment to be sure of peace, that peace is the right way to choose rather than violence. If you choose violence, you choose destruction. If you choose violence, you choose no development in society.
For them, peace is not just a concept. It is a necessity for survival and progress. This year, the Corps is amplifying a simple but powerful message. Talk peace, spread peace, and live peace. As the world marks the International Day of Peace, the NSCDC insists that Nigeria's journey to development can only be paved with tolerance, unity, and the courage to choose dialogue over division. Jessie Tafida, TVC News, Maiduguri.
Talking of health in general, I'm sure you must have heard of all the statements that is being made across, especially on maternal and child mortality. Borno State is amongst the highest state with highest maternal and child mortality. I think number 3 within the country. So that means we have a very big burden on us. So the government, led by Professor Zulum MNI, thought over it and came up with a program in order to reduce the maternal mortality. And that is where the program of free maternal was born in. So by free maternal, I mean to say any woman that has conceived is free to come and attend antenatal clinic and deliver and have their postnatal care here free of charge. No matter what, even if it is cesarean section that is to be carried out, is free. And we've started enjoying this. Many of our teeming populace that are pregnant are now patronizing the state hospital for this particular program. And prior to this, I know the maternal mortality was the highest. Now we are yet to see the statistics after the program must have come on board. Then we are thinking of having a change of statistics, certainly. So this is one big leap by Professor Zulum. We cannot be more grateful than that. Very, very grateful. Yes. Thank you very much. For the state hospital, I think over a period of maybe close to 2 decades, we've been surviving on overhead cost of 1 million naira. This is a hospital of 542 bedded capacity. 1 million is just infinitesimal. So when he learned about it, he now upgraded our overhead cost. He tripled it. Then he went ahead to make sure all the departments are receiving their own separate overhead costs. I think that has made the hospital to attain the state that we're in now. You hardly see deaths within the hospital. The smelly nature of the hospital has now changed. Patronage has increased. Those people that are used to maybe going to other places, other states, or even teaching themselves, they are now the same people that are coming in here, patronizing us more than any other place. That is why the workload is very high, very heavy workload. Whoever that works in state specialists certainly he can work anywhere. The manpower is quite low, it's not optimal, but the workload is quite much. So the governor has made a very big leap by coming up with these programs. And recently he has upgraded the medical salary scale for doctors. And he has the intention of attending to the other health personnel, nurses, pharmacists, radiologists, radiographers, and so on, together with the laboratory scientists. Almost everybody will be carried along. So these are giant strides in order to change the narrative of health within the state, and specifically within the state hospital being the biggest state-owned hospital in the state. He has also, you can see some structures coming up within the hospital. Some of the wards are just too compacted, they are too small. Remember, this hospital was enacted in 1928 as a district hospital to cater for the state. Then it was, I think, northeast, not only Borno alone. So as such, there is need for it to be expanded. So there was an expansion in 1942. So thereafter, there was also an expansion during Senator Ali Morishal, the then governor at that time. So those are the expansions that we had. And now the population, because of this insurgency, has, I think, doubled, or should I say, almost tenfold compared to those days. And the bedded capacity, initially it was about less than 100. Now the hostel bed is 542 and still expanding. With these new buildings that are coming up, the hostel will expand to maybe even close to 1,000 bed capacity. So as such, the staff requirement is much more than what it used to be. So now we have started expanding the hostel vertically. Ward 1 is gone, that is the orthopedic ward, which was just a flat 42 bed capacity, is now being transformed into 150 something bed capacity with a story building, I think G+2, that's 3 story building. And there's this particular plan of demolition Ward 2 and Ward 3, that's female medical ward and male medical ward. Will also be expanded vertically. So, it will change the narrative of the hostel completely. The era of no bed will come to an end. For now, we have constraint of bed. The bed spaces are always occupied. So our bed occupancy is almost 100%. At any point in time, as you are discharging a patient, some have already queued up waiting to be admitted. So the hostel is like a beehive of activities throughout, almost through all the clinical departments and the supporting departments also. There are 2 more new departments have been created, the Department of Hematology and Blood Bank. I think the Blood Bank is one of the best, based on several assessments by partners, government agencies, and so many other personnel that came in to assess. It was one of the best. And at any point in time, we have O negative blood, maybe 3, 4, and we have so many donors that are known, that have been earmarked, that we can get to them. And almost all the times, we have blood for emergencies. So we don't expect to lose a patient because of lack of blood. This we can say with our heads off. And histopathology department, that's the second one, has also come to stay. We can now carry out autopsy here without going to other places. We can have our histopathology, any swelling that you have in the body, you can remove and run a test here. Even for special procedures have been carried out here, so we have no issue with that one. So I think it's a very big step in going up for the state students. We've also, with the supports and sponsorship that we are getting from the government, we've now gotten 4 of our departments have been accredited by West African College of Surgeons and National Postgraduate Medical College of Nigeria, or both. The first department that was accredited was a radiology department. That is the department where we have X-ray, ultrasound scan, CT scan, and MRI, magnetic resonance imaging system. The MRI and the CT are one of the finest and best for now all over the world. We are enjoying the services. except for occasional maybe challenges of maintenance, which the government has never felt it. They are always in support, especially His Excellency Professor Zulum, because whenever a memo is written on this, the maintenance of this machine, which is heavy, he has never questioned. All he needs to do is just to make sure really they are all needed, and he will now assent to that. The hostel has also witnessed a monumental change in terms of power supply. Initially, we have the national grid as well as generators. We have 3 500 kVA generators, 1 800 kVA generator, and so many other assorted generators, 250, 200, 150, 100, and so on, to take care of most of our big machineries as well as our boreholes. So the third alternative was solarization. The whole of the hostel has been solarized, and now we're enjoying the solar power throughout the hospital, especially for the wards. All the wards have been solarized. So with or without the national grid, we have light. With or without the generators, we have light. And even for the generators, it is the same government led by Professor Babagana Zulum MNI that is supplying the gas. There was a time when gas is being supplied for almost all the generators. Then there was no solar. So daily we are consuming almost close to 1,000 liters, which is quite huge. But now because of solarization, it has now come down to its lowest. Even not because of some departments are yet to be solarized like this. Like here in the admin department has not been solarized. We are waiting for maybe the third batch of solarization. The admin portion will be taken care of, because the admin is also housing the medical record department, the nutritional department, as well as the Boschma axis of the hospital. They are all being housed within this particular block. So once it is solarized, all those departments will be carried along. Then the antenatal clinic, where we do see a lot of pregnant women daily, except for Fridays, Saturdays, and Sundays. All other days, you see them in batches, maybe 200, 300. It's quite a huge number. So there's need for us to have a solar there. That is for the solar. I think we are very grateful. People are now enjoying the stay in the hospital. Gone are the days when people will be asking to be discharged. Nowadays, even if you discharge them, they'll say, no, please, can I stay for maybe a few days so that let me recuperate well? Because, you know, light and water are no longer issues here. So this is a very big positive development for the hospital as well as for the populace in general. They are enjoying the services here. And those people that are used to going to private hospitals, you see them now. All of them, they'll be queuing up here. Initially, because of the order, nobody wants to come in, but now things have changed. And the services are all the same, if not better than other places. So that is why we are saying kudos to His Excellency, the Governor of Borno State. Then part of other progresses are in terms of water supply. He has upgraded all our boreholes to maybe dual, both AC, DC, solar boreholes. And another new one was also built, courtesy of ICRC, but certainly it is the government that gave them the enabling environment to come and have it done here. So all these are a positive development for the hospital. Then there's free dialysis. For those patients that have renal shutdown or kidney diseases that cannot be handled by any other means except for dialysis. So we have a center that was built by an individual, and now the government has already, the governor himself, I think he came here and took it upon himself to be providing all consumables, drugs, and every other thing that is needed so that patients will be having free dialysis. Now free dialysis is being enjoyed by patients. Maybe after this interview, you may need to maybe talk to some of them. This is one thing that consumes a lot of money. I think it has impoverished so many communities, so many families. But with this coming as free gift, think we have no other thing than to thank Allah and thank His Excellency for being so magnanimous to give our teeming populace this free dialysis here within the state capital, in state specialists. Part of what I call it as also a giant leap is the accreditation that we had for various departments. I've mentioned radiology. Now anesthesia department has also been accredited, and obstetrics and gynecology has been accredited, and surgery, the recent department that was accredited was surgery department. We're only waiting to accredit internal medicine and pediatrics, and which we on our own part were making all contacts to make sure we secure accreditation for all those departments. So with this accreditation, it means we'll be training postgraduate doctors to become consultants. And once you are able to train up to the level of consultant, it means you can supply your own fuel. That means the era of shortage of doctors will be over. Now for all these departments that I mentioned, except for surgery, which was recent, all others have senior registrars and registrars, so many of them. Like radiology, maybe very soon some of them will go for their Part 2 examination. They've been passing their exams without any problem, without any tears. So you can see once we have the enabling environment, you can do a lot of things because the talent is there. So very soon we'll have our own indigenous consultants here within the state specialist. Now the name state specialists have been surpassed now. This is a tertiary health institution, just like university teaching hospitals. We're also training postgraduate. For anesthesia, there's also a program of diploma, which is meant to have hands-on training for our teaming doctors that want to specialize. So you can see the giant stride of His Excellency has also touched us. We are moving along in tandem with all his plans. Looking at the 25-year development plan, the 10-year strategic plan, the hospital is moving along with those ones. So for that, from time to time, there is supply of basic equipment that is needed within the hospital to cater for patients, especially the emergencies. Everything is now being pursued, and there was never a time when the government denied us. The moment we request for, you see approval coming. For that, we are also happily working, despite the fact that the workload is huge, but still our movement has been gingered by the way the government is responding to our needs. And part of what we are also looking at as a giant strategy is now we can generate our own oxygen. Gone are the days when we buy oxygens, sometimes across other states, because once it is not available within the state, we have to buy it, even if it means going to Kano and so on. Now, University of Teaching Hospital acquired its own oxygen generating plant. So it became closer to us, we are buying from there. Now all of a sudden, because of the contacts and advocacy that is being made by the governor across the world, now Japanese government, together with UNOPS, came up with an idea of giving us oxygen plant, twin oxygen plant, which is one of the largest within the sub-African region. So we are now generating our own oxygen to be given to our patients. And we don't charge anything for all those that are consuming oxygen. Some patients are oxygen dependent, but still we don't falter, we produce the oxygen. And for the production of oxygen, we are yet to start utilizing the national grid because we are waiting for some bureaucratic procedures to be done. But for now, we are generating using the gas on our power plant. Yeah, thank you very much. One of the challenges is human resource, from top down to the bottom, from the highest to the lowest. We are in need of human capital. We are seriously in need of it. Some of the departments are experiencing a very, very challenging situation. You know, I've told you the patient turnover is now highest. but the manpower is dwindling. And it's not peculiar to state specialists, it is peculiar to all over the country. Because of this JAPA, people are leaving the country to find some greener pasture. So the same thing applies here. So we are losing a lot of our personnel, especially those that have been trained, the good ones, you see them leaving. Okay? Then work becomes somehow monotonous and boring. Even not for the way or the approach of the governor, by now the hostel will have been empty. But whenever, after some few months, he will be asking, what are your challenges? We'll mention it. So actually, you don't expect your problem to be sorted out 100%, but he goes to a certain extent to sort out our problem. But for now, the human resource, starting from the doctors, we are critically in need of doctors in some departments. Nurses, some departments, because of lack of adequate nursing staff, maybe we even match. In the same department, we match on board to give them the best of services, which we think it would have been better if we separate them, which is our challenge. Then security. We lack adequate security personnel within the hospital. If to say we have enough security personnel, some of the things that we are seeing within the hospital, you may not see it at all. The littering by patient and patient relation will not be there just because there are no security personnel. Even if there are dustbins, you don't see them utilizing the dustbin. They just drop it. If you have security personnel, no, pick it up. You pick and drop. So you see the cleanliness will be maintained throughout. But for now, we have to employ or deploy cleaners maybe on several times. Those that are doing their morning, they come out twice. Those that are doing afternoon, evening, and so on. So it's a little bit difficult. And because of lack of enough security personnel, we ended up having some of our facilities vandalized. The hoodlums, you see them coming in, some you'll disguise them coming as a patient or patient relation. Maybe at times even some staffers have been caught. Those staffers that have been caught vandalizing or stealing, we send them away to sanitize the whole of the system. But we still have these challenges. Just even recently, they vandalized so many of our structures. The theft of handsets, laptops, and other belongings to either the staff or patient relation is just on the rise. Sometimes even attempting to steal a car or stealing the stereo of a car, battery of a car, battery of our ambulances. So they are all part of the challenges that we are facing. Very difficult. On a daily basis, catch thieves, send them to Dendal police station or even to cracks, but still they are not, it's not been tackled 100%. And amongst this security threat is the fighting by patient relation, especially those that are impatient. Patient relations that are impatient, you see them coming, someone will come with his own dad. You say, no, leave that patient and attend to my dad. While in the actual sense, the first patient that is being treated has a grievous condition. You allow him to go, he may perish. This old man can maybe stand because his situation is a little bit better, but still they'll insist on. Sometimes even hitting, beating, tearing the clothes of our staff and so on. And you discover that those that have high morale, their morale will be dampened. Sometimes you see those ones coming along with maybe even weapons like knives and so on. So what we have as a security personnel, the number has dwindled. Initially, we have up to 100 plus security personnel within the compound. Then everything was just working out for us normal. You hardly hear any complaint, any fighting, shouting, none. But now that you don't see security personnel, you see littering, you see fighting, vandalizing, everything is linked to lack of security personnel.
That's the much we can take on today's edition of Borno Restoration. Thank you for joining us. We'll be back next week for a fresh episode. I am Jessie Tafida. Goodbye.